And let's see if I do this correctly without.
This meeting is being recorded.
Got it. All right. And everyone can see this, right? We're good. Is that a yes?
That's a yes. Yep, we're good.
Okay. Just because I can't see the screen, all I see is my presentation now. So, but okay. Good morning, everyone. Thanks for having us. My name is Mike Maniosi. I am the Community Engagement Program Manager with Excellus Blue Cross and Blue Shield. I am here today with my amazing teammates. And today we are going to discuss mental health care and what the Community Connection team does in correspondence with mental health care and how we all work together. So we'll do a meet and greet. I just introduce myself. I'll let Christina and Deja introduce themselves at their slide so they can kind of go into, who they are and better understand how they do what they do with their teams. So our mission is to help people in our communities live a healthier and more secure lives through access to high quality, affordable health care. That's our mission. That's what we stand by. So we really want to make sure that everyone has everything they need to live a more healthier life. And now I'm going to turn it over to Christina.
Thanks, Mike. Good morning, everyone. So my full name is Christina, but everyone calls me Tina. And I am the behavioral health advocate here at Excellus. And I am a licensed mental health counselor by trade. I was previously working as a therapist at Evelyn Brandon for quite some time before transitioning to my current role. So I'm really excited to talk to you a little bit about mental health and substance use. Mike, can you go to the next slide, please?
Yep.
Great, thanks so much. So I just put this slide in here. It's just the definition from the Center for Disease Control. And I'm just going to quickly read this and we'll talk a little bit about it. A mental illness is a medical condition that disrupts a person's thinking, feeling, and behavior, a person's ability to relate to others, and management of daily activities is affected. So it's a very broad description of mental illness. And for a long time, a little history of mental health is it was really separated from a medical model or seen as a medical condition. So it's really great to see that mental health is now being seen as a medical condition that can be treated just like any other medical condition. Next slide, please. Okay, now we kind of get into the nitty-gritty of what mental illness is. And really, it looks like a lot of things. It really depends on the person and the types of symptoms that they are experiencing. There are a couple of callouts that I really want to emphasize regarding mental health is it does not discriminate. It is not something that we should be ashamed of when we're experiencing it. And about 80% of Americans experience a mental health condition during their lifetime. These are just some of the kind of symptoms as you see on the screen in the chart, but just calling out really the treatment of mental health or getting support for mental health conditions looks very different from each person. And depending on what kind of beliefs and backgrounds folks have really guides how they seek mental health support and treatment. Depending on what they believe regarding, for example, medication support, if that's something that they're interested in looking at for their symptoms, or if it's just more of like a talk therapy, working with a therapist, or it can even look like getting support from a support group, going to a meeting, those kinds of things. I know I'm slowing down my talking. Is there any questions so far for mental health?
I don't know if you see that in the chat there, Tina. One teacher asks, what are some symptoms?
Oh, good question. Okay, symptoms. So things that can look like, for example, anxiety, depression. And when I say anxiety, anxiety can look like a multiple of different symptoms. Maybe a racing heartbeat can be something with anxiety, racing thoughts. It can also look like a stressor, some type of stressor that causes anxiety. Depression's another one. Depression doesn't just look like sadness. It could be a multiple of different things. Not finding enjoyment in some of the things that you usually enjoy participating in, even low mood, crying more, sleeping less, sleeping more are huge ones. Okay, I see another chat, a question. Okay, crying and chest tightness, are they symptoms of a mental health disorder? Not necessarily. It could be a stressor. That's another thing regarding mental health symptoms. It's really when you work with your provider, so that could be your doctor, your therapist, even a psychiatrist, is really kind of getting down to some of the key roots of some of those symptoms. So you may experience depression, and your depression may look very different from the person who's sitting next to you who also has depression. It's very important that if you are experiencing things like crying, chest tightness, and you're worried about it, you should really talk to a provider. Which provider or doctor that you talk to is really dependent on the person, who they feel comfortable talking to about these symptoms. It is very important when you do have an appointment with your doctor that when they do your screenings, so they'll ask how you're feeling, potentially some mental health symptoms. It is important that you're honest. I'm just going to stop there about honesty about mental health. There is a lot of stigma still to this day. I think our society is really working on that when it comes to talking about our mental health. But I think since COVID, we've really seen a change in people taking control over how they're feeling and getting that help that they need. That is one thing that's so important, is getting connected to doctors and providers that make you feel comfortable enough to be honest about your mental health symptoms. Other symptoms that people could experience could be auditory hallucinations, hearing things, or even visual hallucinations, seeing things, racing thoughts, even feeling like there is somebody in their head telling them to do something. That could also be a symptom. Seeing things that aren't there could also be a symptom. It could also be things like paranoia. Paranoia meaning you have a feeling somebody is, or something is watching you, is following you. Those could all be symptoms. Now, does that necessarily mean that it's a disorder? Not at all. That's why you need to talk to your doctor and really kind of hone in to the symptoms that you're experiencing to get down to, is this a mental health diagnosis? Other things too is, feeling like suicidal. You have thoughts of being helpless or hopeless, or even feeling really angry is another symptom. And I should say angry at situations where you recognize you shouldn't be that angry, but all of a sudden you go from 0 to 100 with your anger could also be a symptom. Other things you could experience is just overall kind of numbness. That could also be a symptom where you recognize things that used to make you happy or that you engaged in. All of a sudden you don't feel anything, could also be a symptom. Some of the other things too is when you're starting to experience a symptom that you're not liking, that you would like to work on, maybe you want some support, you could even talk to your primary care provider. They may suggest talking to a therapist or even a psychiatrist. And you know what, let me back up here. The difference between a psychiatrist and a therapist is a psychiatrist can prescribe medication for your mental health condition, a therapist cannot. So that is different. You'll also hear therapists called a counselor as well. Now, medication is not necessary for every mental health condition. It can absolutely be a part of a person's mental health journey if they choose it to be. There are other things that they can incorporate. For example, you'll hear a lot about coping skills. So that's one thing therapists, counselors, your primary care provider, your psychiatrist will say the terminology coping skills. And what that means is teaching you skills that will help you manage your mental health condition. So for example, if I get anxious, if I get chest tightness or my heart rate is beating every time I have to go outside or every time I have to go to the grocery store. It's overwhelming. There's a lot of people now that COVID's over, not over, but dying down, right? But let's say that I get anxious. I get anxious about all of these people. I'm trying to shop. A coping skill that I may work on with my therapist is grounding. So taking 5 deep breaths, identifying 5 things that I can see in the moment to help me refocus from the anxiety I'm experiencing from going into the grocery store and all of those people being around. So you'll hear a lot about coping skills and working those into your mental health treatment and support. Let's see, I should stop there. I just gave a lot of information. Any questions? Any more questions? Okay, and Hannah, there's nothing coming in the chat. I closed it by accident.
Yep. Nope. It seems like that's good.
Okay. And just one last thing I want to emphasize too, mental health really looks different and how people get treatment. It looks so different. And it can take time to kind of find the right kind of team and right kind of skills that you want to put in. That is probably one of the most difficult things that I've seen when working with clients in the past was figuring out, the meds, if they decided to take a medication, and also kind of the steps that they needed to take within their immediate environment to help support their care, and kind of the providers that they needed to incorporate. That can be really frustrating. The one thing I can encourage folks to do is keep trying. It's like finding that, the perfect pair of jeans. It's not always the first pair of jeans you put on. It may take some time to find the right combination to help support you and to see some changes. There are also some supports, and I'll put all of this in the chat after my section for everyone who's on today's call. But there are some supports too that can immediately help get you connected. So if you're feeling that you're just having such a hard time in that moment, you don't know who to call or what to do, you can always call, of course, 911, but you can call 211 as well if you don't feel like it's an emergency, but may need connection to services. They can help get you connected to services in your area. They will also kind of check in and see if you maybe need someone to come to you in that moment and maybe talk. There's mobile teams that come out. They can help support you. They have licensed professionals who are a part of that team who can kind of talk with you, kind of check in on what you're experiencing. And if needed, they can also transport you to the hospital for an additional assessment if you feel like that's necessary. And I will put all of that information once I'm done here. And Mike, can you go to the next slide, please?
Absolutely.
One teacher asks real quick, they just put it in the chat, is it 311 or is 211 a new number? So I think there's 211, 311, and 911, if I'm not mistaken.
Okay. Yes, it would be 211. What it would do is it's an automated message, or it takes you to an automated message first, just looking for what location you're at. So you would just put that information in, and then you get a representative, and it's manned 24/7. And then they're going to get some additional information from you on what's going on, what questions you have, maybe what supports you're looking to get connected to, and then they'll give you those resources. You can also too, there is 988. which is kind of the new 911 for mental health emergencies as well. I'll put that in the chat as well for Monroe County only residents, I will say. I don't know if that's up and running for all of New York State, but I will put that in the.
Are there interpreters for either number 211 and 988?
Ooh. I will have to, Hannah, get back to you on the 988 for the interpreter piece. There are interpreters available for 211. Great question. All right, so part of mental health is also substance use. So just on this slide, it has some of the symptoms that somebody may experience when they're having a substance use condition. So I'm gonna say usually a substance use disorder starts out with substance abuse. By no means does someone start using a substance with the intention of becoming addicted. So things that you may notice over time for folks who are developing a substance use disorder is going to be tolerance. So using that mood altering chemical more. And I should state mood altering chemical could be things as you'll see alcohol, marijuana, cocaine, but also some other mood altering chemicals we really don't think too much about. For example, caffeine. Caffeine can, there is a diagnosis actually for caffeine dependence. So you're going to notice things, bodily changes, so needing more tolerance. You also may notice some mental changes. And when I say mental changes, it's more of you're thinking about that substance more, you're wanting to use it more often. You may discontinue some other activities that you enjoyed in order to use that substance more. And nobody intends, it's not something that we identify quickly as people. It's something that kind of builds up over time. You also may notice conflicts within your relationships for folks that are developing a substance use disorder or have a substance use disorder. It may impact how they communicate with loved ones. Their loved ones may even also identify some changes and bring those up and verbalize those to folks who are experiencing a substance use disorder. This is also a huge, substance use disorders are things, you know, from the mental health field, we continue to break down some of those stigmas. You'll hear there's this really negative vision or idea of folks who are suffering from addiction. And, you know, that's not true. Addiction does not discriminate. The same with mental health conditions. It's really anyone could become addicted to a substance, and it impacts everybody differently. How they seek services and treatment will look very different. And it also depends on the substance that the person is addicted to. So for example, things like opiates, so it's going to be like painkillers, it could be heroin. Building an addiction to that type of chemical will result in more severe withdrawal symptoms. So withdrawal symptoms are when an individual tries to take less of that drug or substance, and they notice bodily changes. They may feel sick, sick to their stomach, vomiting. They may even have hallucinations when they're withdrawing. In cases like that, treatment would look a little different than withdrawal from other substances. It's going to negatively impact your mood. It may also impact, other kind of bodily function. So the withdrawal symptoms may not be as severe, but you may experience some negative symptoms. That's also going to depend on the severity or seriousness of the treatment. For example, alcohol withdrawal can look very different from other mood altering chemicals. And it's also very dangerous to withdraw from. It can actually cause death. So you'll see, or you'll hear of things like inpatient rehabilitation or detox. That may be something someone who is experiencing alcohol withdrawal would need to take advantage of, just to ensure they have medical team that is available to help withdraw them appropriately. It also helps them, even with the opioid addiction or heroin addiction, it just helps to alleviate some of those negative symptoms. If you're going through any type of pain or discomfort, it's natural for a human not to want that discomfort. So inpatient rehab, inpatient detox will definitely assist with some of those immediate withdrawal symptoms. Lots of information about substance use. Any questions? Great. Okay. This will also too, treatment for substance use disorders is very similar when it comes to finding treatment patterns or a combination that works well for the individual. When they start working with what you'll hear mental health folks say is kind of like a treatment team. There are medications available for folks who may be experiencing withdrawal or even cravings to help them manage some of those immediate symptoms. There's also great resources, especially in Monroe County, regarding support groups, self-help groups. That might be something NA, which is Narcotics Anonymous, or AA, which is Alcoholics Anonymous. There's also an array of other types of self-help groups in the community. Also seeing a therapist. Going to group therapy is a big one that you'll see for the kind of treatment options for folks who are looking to get sober and work a recovery program. And what group therapy kind of looks like is it's a small group of individuals who are all experiencing very similar conditions, and they work with a counselor who will help not only give them some education on the different topics, but it'll also help them get support from each other. We're not alone. People sometimes, especially with an addiction or substance use, it's shameful. They want to keep it private. They don't necessarily communicate with people about that. So a group therapy setting really helps them to share and feel comfortable to kind of relate to others who are going through similar situations. Hannah, I saw you went off mute.
Yeah, the chat says, a student asks, what is a mentally ill person called?
A person. There's really no name for someone who has a mental illness, rather than they're a person. When they have a diagnosis, I will say it's not intended for them to identify like, oh, I'm schizophrenic. It's a way for them to help advocate for what they need for their mental health, but no means does it define them as a person.
Another teacher worded it better, or just in a good way, a person with a mental illness. It's just something that they happen to be going through.
Yes, absolutely. And it's their mental health. It's a part of taking care of themselves. And I think that's something that we've really tried to work on over the last several decades. A person with a mental health condition is no different from someone who has a medical condition. It's no different from someone who has diabetes or chronic pain or even cancer. It's a medical condition that they're working on creating a healthier version of themselves to make themselves feel better. Great question. Okay, I think if there's no questions, I do have one other thing about substance use disorders, is there is a great support system too for loved ones and friends and family who may have an individual that they care about who's also in active addiction or trying to work a recovery program. We really try, especially with substance use, we recognize it impacts the whole family, their whole family system, their support system. So there are a lot of resources out there too for family members and friends to connect to, because it can be very hard to watch a loved one go through active addiction. So that's another great thing. And then next slide, please. All right, this is more of giving some information about what we do at Excellis and kind of my role and how I work with our case managers. So we do have a team who is dedicated to supporting members who have Excellis membership, who need connection to services. So really, it's kind of what that member needs for their healthcare. And when I say healthcare, it could be a medical condition, it could be mental health. Go ahead, Hannah.
Oh, okay, sorry. Another question popped up in the chat. It just says, after the factors that cause the mental illness, will they be cured?
Oh, okay. That's a great question. So it really depends on the condition. So there are some mental health conditions that will need to be managed throughout your lifetime. And it's not necessarily, it's just dependent on our brain anatomy and the types of chemicals our brain is producing or not producing. So there may be some mental health conditions that will need to be managed throughout someone's lifetime, which means some type of, if they choose medication, working with a particular group of providers. There are other conditions that once you have developed some skills, for coping skills, like I had mentioned earlier, that will absolutely, once you have good skills, you feel confident, you're able to manage the symptoms, you may not have to go and see a provider as frequently. You may not need medication. You may kind of like do therapy periodically just to kind of check in. It might not be as frequent. So it really depends on that particular condition. Is that okay? I just want to make sure. Any other responses to that? Okay. All right, so case management. So this is really, it's a free service. I work closely with our case management teams, but it's really to help members kind of get connected or become educated, get some information on the services that are available to them and how to get connected. So like, for example, I work with a lot of members who are looking to get connected to behavioral health services and really don't know where to start. So one of the things I do is I talk to members about what their goals are, what they're currently experiencing. And I would like to say this is completely confidential. So when I work with a member and they're sharing some of their conditions and what's going on, that stays between myself and that member, unless they would like me to advocate on their behalf. And then I get verbal confirmation to work with providers. But it's really kind of, the member gives me some background on what's going on, what they're looking to engage in, and then I help them find providers in their area that they can connect to. So common things I will ask members is, are you looking for some type of medication to help with your condition? If so, let's talk about finding you a psychiatrist in your area. Or if you're maybe not thinking medication is for you and you just want to talk to a counselor or a therapist, let's find a therapist in your area. Other details that you'll find, I'll ask, or even other, if you do get connected to a case manager, will ask, is things like, do you prefer a male or female provider? That is very important. So we'll ask things like that. Language, making sure that the provider is able to either provide interpretation services or they can speak that language. So a lot of the members that I work with, when we're looking for a provider who speaks Spanish, that's a very common one in this area. So we look for a provider who can directly communicate with that member in Spanish for them because they prefer to speak Spanish during their sessions. Other things I'll talk to members about is levels of care. And levels of care is depending on what the member is looking for. So for example, if I have a member call in, they're actively using a drug or alcohol, and they would like treatment. Some of the things I'll talk to them about is their different levels of care. So do they want to be admitted to a hospital and do detox services? Do they want to do an outpatient chemical dependency program? So inpatient services means it's going to be in a hospital setting. So they're going to have 24-hour care, monitoring. It's kind of like it's like an initial step. It's not a permanent step. It's temporary that they'll be in the hospital setting. Outpatient chemical dependency, Services is a little different. It's like the group therapy that I mentioned. So they would go to a freestanding building and go a certain amount of times a week, work with a therapist, potentially talk about craving medication or withdrawal medication at that level of care. Or depending on like maybe something that's a little less, I would say less demanding, because sometimes with an outpatient chemical dependency program, it's multiple times per week, but maybe they just, they're already working a recovery program. They just need to engage with a therapist because they haven't been connected to a therapist in quite some time. So we talk about those different levels of care and then help them find providers or services that are going to be accommodating for that. Now, I work to find services with members and also advocate with providers, but our case management team does all the follow-up. So they'll work closely with that member, make sure that they were able to get those services or connected to that provider they were hoping to get connected with. But they'll also make sure that if there's any other additions or supports needed, they'll make sure that that member gets connected to those. They're also a great sounding board. They all have clinical backgrounds. It is confidential, the items that they're working on. And really it's driven by the goals that the individual has. So it's not something where our case management team really pushes them to meet certain goals or criteria. It's really what the member wants to work on, which is really nice. They're also great for answering questions, getting connected to new services. Sorry, Hannah, go ahead.
No, it's okay. I just had a quick question. So a person who has Excellus would go to see their primary care provider, and then would that provider recommend them to a case manager? Is this like the same as like the doctor's offices, or is this separate?
That's a great question. A primary care doctor can absolutely refer a member to case management. The one thing that we really emphasize is that our member is in agreement with it. So they would have to agree to case management because it is member driven. So the member would have to, be interested in working with a case manager and kind of speaking to them. We do have other ways that a member can actually reach myself or a case manager is through a case management line, which I'll put all this information in the chat when I'm done talking here. And then they can also, they can call into the case management line. They can call even that 1-800 number on the back of their insurance card and just say, I'm looking to, connect with a case manager. And then I actually have a specific BH advocate number that I will provide, but it's also listed all on our website. So if they have questions or maybe start doing a little bit of investigating on our website, there are resources that are listed, but they, at any time, they can access case management.
Okay, that's a good answer. Thank you.
Yeah, absolutely. So no referrals from providers is necessary for them to connect to a case manager. The case managers they're currently all telephonic via phone. So they really work to schedule whatever works for the individual who's enrolled in case management. So whenever phone calls are, whenever they're free to have a phone call. Case management, there's no time frame. So they can be in case management for, 3 months. They could be in case management for over a year. It really depends on what goals they're working on. And they can also help with things like getting referrals. That's a big one, is referrals to specialists. So if there's something going on, if they have a diagnosis, and this is either could be medical or even like mental health, and they need a referral to a specialist, the case manager will help assist them with that. Any new medications that are added to their regimen, they'll also kind of check in with them since they do have that clinical background, see how those meds are working and if there's any concerns. They can also help with transportation. That's a big one. If there is medical appointments our members need to make, and it's just not going to work for their schedule to take the bus, they can't take the bus, they will help get them what we call Medicab. So it's medical transport.
That's really cool.
Yeah, I should also just emphasize it's only for medical appointments. Um,
Yeah.
okay, and then
Are there, when somebody wants to connect with case management, also common question interpreters among case management? Okay.
yes, depending on their language preference, either that case manager will be able to speak that language or there will be an interpreter.
Okay. Cool.
Okay. And those interpreter services are confidential. All right, and next slide, Mike. Okay, great. Well, I appreciate everyone's time, and I'll put all of that information in the chat as well, Hannah, and thank you. And if there are any other questions, I'd be happy to answer them.
Thank you so much, Tina.
And now we're going to pass it over to Deja, and she's going to talk about the community connection team and what she does. So Deja, it's all yours.
Hello, everyone. Good morning. So happy to be here with you all today. Yes, I'm Deja Richardson, and I'm the manager for the Community Connections Department. And our department is actually an extension of that case management program that Tina was just sharing about. So again, really happy to be here. And Mike, next slide. I'm just going to hide these videos. So the mission for the Community Connections Department is to be recognized as the community health experts in the relentless pursuit of engagement in locating members that have been lost to care and then reconnecting them to community resources, their providers, as well as the case management program. And our goal is to assist with closing social determinant of health type barriers for members of all lines of business. So from the members' experience, this will include or can include home visit outreach to locate members that are unable to be reached telephonically. The case management team is also sending out a letter to the address that we have on file to try to make contact as well. So whether it is an initial outreach where they're unable to make contact with a member, or if they've been able to speak with them initially and get them enrolled in the program, but then lose contact with them at some point, then the member would experience our team coming out to check on them, see if we still have a good address, and try to get them back connected with the case management team. We are also referring and enrolling qualified members into health home programs, which is a separate community-based service, which is covered through the Excellus insurance coverage. We're also connecting members to community resources. So if there's a need for food or a housing list or any of those types of things, we're helping out with that. And as Tina mentioned, 211 is an amazing resource, not only for mental health services, but in general for just navigating resources and community services that are available. Let's see here. We're also providing educational materials based on the conditions identified through case management. So like Tina said, that education piece is very huge with case management, so that the more educated someone is, more informed they are on their diagnoses, the better the outcomes with managing that diagnosis along the way. So from the employee's experience, it will include managing our in-house food pantry that we have, which is all employee donation based. We really do work with an amazing set of people. And in addition to managing that food, we are also out in the community making emergency food deliveries to our members in need, providing emergency diapers or formula or food, whatever their need may be. From the employee's experience, it also includes working closely with our community resource partners to assist in identifying resources that are available to the members that are available to the members in their local community. We also participate in as well as host community events. Some are specific to our members and some are for the community as a whole. And at these events, our goal is to always address those social determinant of health type barriers. So again, whether it's a housing issue, whether it's food insecurity, whether it is a need for mental health resources, whether it is a need for safe housing, and so many other things, we are always looking to host events that are addressing, initiatives, whether it's health related or social needs. Next slide, please. All right. So our team is considered that non-clinical boots on the ground team in that relentless pursuit of engagement. On average, our department receives about 1,700 referrals each quarter coming from the case management teams. Of those 1,700 referrals, we are able to maintain a success rate of about 45 to 50%. We are very proud of our successful contact rate in the community, as similar programs average about a 35 to 38% success rate with a similar type of outreach. One thing that we do that makes us a little more successful than average is that we incorporate what we call double backs. So if we attempt a home visit outreach for a member to get them connected to case management and that visit is unsuccessful, we will then go back out to the member's home on a different day of the week at a different time of the day and see if we're able to make contact with that member and begin that engagement with case management. Oftentimes we find that, we might have initially visit them first thing in the morning and the member works the C shift, so they're sleeping in the morning, or we've come right mid-afternoon and they're picking up their little one from school or the bus stop. So again, we're just really relentless in our pursuit to try and make that contact successfully. So we are bridging the gap between the members and the case management departments. Again, we're delivering emergency food and resources when there's a need. We partner with community organizations on resources and services. And our goal is always to connect members to the case management teams. And again, if there is a need when we are at the home meeting with the member for that visit or at a community event, we're also connecting the members to community resources as well. If there is a gap in care, we're addressing those gaps and educating the member on the importance of having those gaps filled and helping them with scheduling the appointment for the transportation, like Tina mentioned, through the mass transportation, or they may be set with a transportation and may need a provider to actually have the service performed. So we may be assisting them with finding a provider as well as the transportation, or either or. We provide the members with government phone program applications as needed. We can assist with getting those filled out and submitted so that the member can receive a free phone in the mail through one of the government phone programs. Again, we also participate in community events and we're hosting events in the community as well. We are also out in the community to engage members in health home programs as well. And we're also doing some telephonic outreach like the case management team to try to engage these members in these services also. We are often addressing those HEDIS gaps in care. So if there is a special campaign, like with February, which just ended, was Dental Health Awareness Month, we're using that as an opportunity to reach out to our members who have that dental gap and again, educate them on the importance of filling that gap and assist them with finding a provider or transportation if needed to remove any barriers with having that gap addressed. Any questions?
Deja, I don't have a question. I just want to say, absolutely, your team is so helpful for our case management teams. You're the pros at knowing what resources are in the community. So our case managers really rely on community connections. Also, the great things that you do for our members. We recognize that, members are maybe experiencing other stressors, not just finding a doctor or getting connected to providers, but may have other stressors that we need to help them with. So we just thank you so much for the support you give our membership and the community, and all the hard work you and your team does.
Thank you. Yes, we do our best. We try to leave no stone unturned. Thank you. Let's see. I believe I saw a question here. All right. Let's see. Okay. So our services are a direct extension of the case management program. So to access us, once you are engaged with a case manager, the case manager would then send a referral to our department. So if there's a need for resources, or again, they're unable to reach you and they're concerned, they would then reach out to us, and then we would go, to the home or the last known address and attempt to connect with the member, and then give the case manager a call to either establish that connection and begin engagement, or reestablish the connection and continue that engagement from there. But if you have any questions about just resources available in the community, or need any assistance again with getting into the case management program, I can absolutely be reached at the contact information here. Thank you all for your time. Again, it was a pleasure meeting with you all today, and I look forward to connecting with you in some way in the future.
So Deja, your contact is a good way to get into the community connections team, or get in contact with your team. That would be the way to go.
No, the way to go actually would be through the case management team. And then the case management team would refer us the member based on the need that they have.
Okay. What is the contact for the case management team?
Let's see here, one moment.
I'm sorry, community connections.
Anna, I did put that in the chat, if that's helpful. I'll do it one more time for the case.
Yeah. Oh,
line.
I see it. Yes. Sorry about that.
No, not at all. And here, I'll just do it so it's a little easier. So I just put that right in there.
Yes, but for questions regarding the Community Connections Department, my email and phone number here would be the best contact information for us. Again, we're like a referral-based department. So all of our referrals for outreach are coming from the various case managers. So whether it's a behavioral health case management program, physical health, maternal child, all of those types of things, our referrals are coming directly from those teams.
Okay. Sorry, before, I think I was trying to say community connections. They're all start with C, so.
Yes, no problem. Yes.
All right. Well, I'll make sure to send along all of that previous chat, Tina, that you sent about all those numbers. I'm going to send that out to everybody just to make sure it can stay somewhere forever in an email. So yeah, we'll make sure to get that out to everyone. But thank you guys so much for coming and presenting. Does anybody have anything last minute you'd like to ask? Any questions or concerns from students? I know this topic is so important. So if you'd like to see more on this in the future, I'd be happy to bring them back, somebody else back. We can definitely work that out.
And I'd just like to say thank you to Deja and Tina too for coming on. It's like I said, I enjoy working with them. They're fantastic. I mean, they are amazing at what they do. So, and to